Full amount?
Yeah.
All right, before we get started, I would like to ask us all to take a moment of silent prayer to remember the people of Ukraine, to remember those Ukrainian Americans that live here in our community, and also to pray for an end to this meaningless violence and bring peace to this conflict. So if we could begin our committee meetings with a moment of silence. Thank you very much, and we'll turn it over to Patty with Health Services.
Good evening, everybody. Our Health Services Committee meeting at 6:01 p.m. Before we get to the resolutions, we have Kim Kaplan, Laura Churchill, and Amanda Lyons here. Kim, did you have anything you wanted to report on or talk about?
Yeah, especially we are in a very transitional time with COVID. Thankfully, the numbers are down, and we know that there's been changes in the guidance. But if anybody has questions or would like me to address any part of this, I would be very happy to.
Maybe just if you could give everybody an update. I know you met with the school superintendents this morning for Greene County.
Yeah, let me come up. I don't know. So we meet with the school superintendents every week, which has been really, really helpful, and they have been so amazing. They have worked so hard, throughout the pandemic. And there's a change in guidance. Obviously, I think a lot of people know the masks were coming off today, but there was a lot of very specific guidance to do with who still has to mask, when you have to mask, and so forth. They seem to have a good understanding. We all just got the guidance last night very late, so it was all new. But they're working through some of the specifics of the distancing and so forth. And it was just a very helpful meeting, and I'm glad that we do that every week. Does anyone have any specific questions about that?
So they haven't changed any of the distance requirements?
Well,
Classrooms are
this is the
vaccinating
thing.
staff. I know that was a concern that we had from the school
I
superintendent.
didn't hear that second
The
question.
vaccinating, the testing of the
Testing of the
unvaccinated
Testing of the
staff.
unvaccinated. So those two questions, one's about distancing of the students. That's a really good question. The other is about the requirement for unvaccinated staff to have weekly testing at the school. So the distancing, the children were able to move within 3 feet of each other, and if they were 3 feet apart and everybody involved was fully masked, they were not quarantined. Now that the masks are off, the area where people are concerned about contagion is still really 6 feet for multiple unmasked people. So the guidance is that either they can do the traditional contact tracing, and if there's a positive, was in the classroom, anyone within 6 feet can be, not that they are quarantined at home, but required to mask for what would be a quarantine period in case they become ill, they don't spread it to their classmates. Or they have the option of having the whole class or the whole group mask, for the 10 days. So they can go either way on that. It's up to the schools how they want to manage it. They have managed any of their quarantining, contact tracing very, very well. They're quite good at it. The other question about the mandated testing of unvaccinated staff every week, the question was, it's still required. The question from the superintendents is, could they use home tests for that? So we've sent that question this morning to the state, and I'm just waiting for an answer on that because that would make it, facilitate it a little for them.
Great.
Kim, where's all this guidance coming from that's telling us distance and if?
So for the first time, it came not just from the State Department of Health, but together with state education. That the commissioner for the Department of Health and for state ed, that the two groups worked together, and the guidance was issued from both entities last night. So that is a change. Any other questions?
Thank you.
Chairwoman Handel, I just have a question for Amanda on mental health. What have we seen? I saw somewhere at the federal level, I don't know if the state is in the midst of a state of emergency on mental health?
We haven't heard anything. I mean, we are seeing a slight uptick since COVID with people coming in. We're seeing more engagement. I think a lot of that has to do with the fact that we provide telehealth now that we didn't previously have. But we haven't received anything. There's concerns about the overdose rates, certainly are spiking. So I think that's concerning, especially because we've been in this grant program where we're supposed to be reducing those and reducing the deaths, and we actually are seeing the opposite trend despite all the efforts that we're putting through. But at this point, there isn't anything coming down from the state.
The first resolution we have, Amanda's just going to speak a little bit about that before we put the resolution out there.
So the resolution is for increase in funding for MCAT. There was some expansion services provided when we were participating in the district delivery systems. So it's like a Medicaid redesign team that came in and said that this is a good place to put money to help cut costs and cut hospitalizations. So with that being said, they were getting about $340,000 annually from both. It was split between the two counties, about $170 from each county was going into their pool to fund their program. District has since gone away. And then we had the introductory of the Healing Community Study grant program that also backfunded the district program to kind of keep them afloat through this, I think it's March 31st of this year. So April 1st, they're kind of on their own. So the lack of funding that they need to move forward is about $170,000 from each county. Both Greene and Columbia agreed to match the amount that we were putting in. But there's some stipulations with our funding because their program is now able to bill for their services. It is capped at 170. So we are going to make sure that they are billing accordingly and they're rendering the services they're supposed to be. Because the whole idea of the program was that it was going to be sustainable, and it's not at this point. So we're going to make every valiant effort to make sure it stays sustainable.
And if something like this happens, is there a review board that would recommend a different direction? If something's not working after adjustments, he is constantly looking in, hey, maybe we need to try this avenue.
Right, so that process, it doesn't necessarily happen as an overall umbrella over every program. I certainly, for Greene County, have spoken to the state quite often about certain programs because we've actually cut certain programs because they're not sustainable. And rather than put money into that program, we found other ways to kind of provide that service. MCAT provides a very important service. I think that, you know, there's nothing else right now that would even match the program that they're providing. To us, I think the biggest problem is we have to advocate to make sure that they increase the rates, make sure it's, you know, that whatever they're able to bill for, whatever services they're providing, they're actually able to bill for it. Because some of the stuff that they're doing is a lot of outreach, which isn't you know, you and I are private insurance. We don't want to get billed for a telephone call, right? But that's time. It's time that they're tracking people down. They're making sure that everybody's okay, that, you know, followed up post-hospitalization, things like that. So with those things in mind, they're working on finding better ways to make that a more billable service or find some way to sustain it. The state isn't really, they haven't been expanding the program's funding allocations from the state aid perspective. So now I think it's up to a service delivery standpoint to find a way to you know, create additional billable services, essentially.
So, like you just said, private insurance or Medicaid, Medicare, I mean, do they review with what's working and not working? And so maybe telehealth is working, but you're not getting the revenues to pay for that. And something else that Medicaid, Medicare, or private insurance has been paying for that's not working, do they review that and then adjust what they cover, their coverage?
Right, so I think the biggest issue is not Medicaid, because Medicaid is paying for these services. It is the private insurances. So a lot of that is contracting and getting them to open up those contracts to cover those services. So they're going to have to come up with, like MCAT I'm speaking of, they're going to have to come up with some solid data that shows that the intervention at point A kept that client from going into the hospital and staying a stint in hospital that would have cost that insurance $10,000. So that's kind of the information that that we put in requirements for this additional funding to make sure that they're going to be providing those types of reports and that we're able to really get good data on what they're doing, who they're serving, what the caseloads look like, what kind of insurances they have. I mean, typically the high utilizers are the Medicaid patients, just due to the disparities in their lives. But that's all stuff that we're working on, and that's why it was all contingent upon proper billing and making sure that they were doing it.
Thank you. Thank you, Patty.
Can I just ask also with the MCAT, do we have a record of how, like, if they're called by our dispatchers? Or do we have a record of if they're showing up or if they're not showing up?
So I'm sure that they have that data. I mean, a lot of the stuff that we get is really their receipt of the call, not necessarily their interaction with dispatch. I don't know if that makes sense because they don't do the interaction. Yeah, I didn't think so. I wasn't, not that I'm aware of,
just
but
call them directly, we don't go to dispatch.
yeah.
Well, Katie Lukowski keeps fantastic records.
Yeah.
And MCAT, from what we're saying, is valuable, you know. I don't know what we would do if we didn't have it.
No, exactly, right.
I second that, we use them there, they divert people from the emergency room left and right, they save the system.
Yeah.
When you say underutilized, is it because people don't know they're there?
I think it's the fact that some people don't know that they're there, but at the same time, I think there's police agencies that don't use them to their benefit as much as they should. You know, we have an avenue that's typically used with the police community of how we deal with mental health stuff, mental health types of situations. However, I don't think that applies to those circumstances, especially when we're young children. We don't necessarily want to expose them to police in that type of circumstance when we have to, when mobile crisis is much more equipped to handle that. So we'll call them for a lot of circumstances.
The hospital grant.
Have they changed their hours?
I think she mentioned that.
They're expanded, yeah, they're expanded.
Plus, they were serving two counties, so they're farthest, east of Columbia County, that we have something over here. We have the time to wait for them to come all the way back over here. So
Yeah. And staffing's been a major issue. I mean, I think across the board, I'm sure every department, every agency has been dealing with, but I mean, it's really hard to get people in this line of work that, can sit at home on the computer and do the same job. So, so it's been tough.
But data-wise, Katie would probably anything that we want. Work on. She's fantastic at that.
Maybe trying to get some of these other police agencies to call. Maybe could we ask them to come, maybe have Katie come and present to us next month?
Sure. This issue was, I'm not sure if you remember, in my dialogue at the budget meeting, we talked about this issue. We knew at that time that their funding was gonna cease, and I had a conversation with Matt Burrell in Columbia, and we both agreed that we would both, like we do with the community college, we would both co-fund this operation because everybody recognizes it's that. Right.
Okay.
Thank you very much, Amanda. Let's finish the resolutions. First resolution, authorizing agreement, Greene County Community Services Board and the Mental Health Association of Columbia Greene Counties for MCAT services.
Rivera Davis.
Vera Davis, all in favor?
Aye.
Opposed? That's carried. Authorizing agreement, Greene County Family Planning and Mildred Ellie School.
Davis. Homer.
Davis, Bloomer, all in favor?
Aye.
Opposed? That's carried. Approving center-based agency provider contracts, preschool special education program. Handle?
Lennox.
Davis, all in favor?
Patty, I just have a question on this.
Yes.
These contracts, all these listed, do they have are they reviewed,
These are all people who are credentialed and all have.
credentialed, but do they ever, does that involve the credential process, is it an annual credential that they go through?
It depends on the
Review?
credentials. You're talking about all different kinds of services,
Right.
physical therapy, occupational therapy, speech therapy, social work, it could be special education. So they all have a specific way, but we do
the children are all evaluated, that's mandatory for the schools.
Okay,
And they do track their progress, so that everyone, that the progress of the children working with the providers is very specifically tracked.
Okay, thank you, Kim. Thank you, Patty.
You're welcome. Randall Davis, all in favor?
Aye.
Opposed? That's carried. Approving individual provider contracts, preschool special education program.
Davis.
Davis.
Lennon.
Lennon, all in favor?
Aye.
Opposed? That's carried. Approving related service provider contracts, preschool special education program. Hobart, Handle, all in favor?
Aye.
Opposed? That's carried. Authorizing agreement, Greene County Public Health, New Baltimore Animal Hospital rabies prevention.
Lennon.
Davis.
Lennon, Davis, all in favor?
Aye.
Opposed? That's carried. Budget amendment, Greene County Public Health, Greene County Family Planning, and Greene County Early Intervention. Handle,
Davis.
Davis, all in favor?
Aye.
Opposed? That's carried. Is there anything else to come before Health Services Committee this evening?
Motion to close.
I'll second.
Lennon? Who seconded?
Rivera.
Mark, thank you.
You're gonna recuse yourself? Tommy Hoyt. Thank you, Tammy. I'd like to call County Resources to order at 6:16. We have one agenda item before our committee. It's the reappointing member for Batavia Kill Watershed District Board. Be resolved that Thomas Jakubowski of Maple Crest, New York, be reappointed to serve as a member of the Batavia Kill Watershed District Board for a 7-year term effective March 16, 2022 through March 31st, 2029. Be resolved that Eric Rasmussen of Acra, New York, be reappointed to serve as a member of the Batavia Kill Watershed District Board for a 7-year term effective March 16, 2022 through March 31st, 2029. And I need a motion on that. Lennon and Overbaugh. Any discussion? All in favor?
Aye.
Could I recuse, please?
We have abstain. Storrington.
Charlie.
Did you abstain? Tom, did you abstain?
No.
Oh, I'm sorry.
No, we just recused this. Any opposed? So carried. That's it for the agenda items on the county resources. I would like to inform everybody for next month, our representatives from the college will be here. I spoke with them. There may be some bullet points you might want to reach out to me on. The discussion I had with them involves the enrollment, the amount of students per classes that they currently have. And I'd also like to talk about maybe getting together like we've done in the past with the Columbia County Board of Supervisors and the college. See where we may be wanting to go down the road here, Sean.
Okay.
But anybody else, feel free to ask any, forward me any questions you might have for them. Again, that invitation is open to all when that meeting is set. And they were very good meetings we had in the past years with them. So does anybody else have anything? Motion closed.
Motion closed.
We are closed. We are closed. Thank you.
Lennon. Rivera.
You should have stayed with the paper. Charlie's having some computer issues.
No.
You just have to click right here.
If you see this thing fly across the room, you know.
The cursor is big enough. I could just see that.
We've got a policy on the destruction of county equipment, so.
This is mine.
It wouldn't be the first time.
Okay,
When do you
if
get
it's yours,
back
feel
there,
free to
Charlie?
drop kick it.
Depending on what direction you're going, be a little more specific.
How the hell did you do that?
All
Okay, I'd like to call the Public Safety Committee to order at 6:20 PM. There's several proposed action items. Before we get into those tonight, we have with us quite a few people, actually. Before I bring up the sheriff and have him give his report and talk about everything he needs to, we have Director Farrell here. So, John?
Thank you. Holy Sheriff, I was gonna go first.
You can't do
Thanks for that. Tom.
Hey, there you go. Good evening, all. Just want to go over the February call numbers. EMS was 302, fire 94, police 689, and the sheriff was 350. The fire investigation team this past month was quite busy. They responded to 5 major structure fires. The hazmat team this past month, luckily they had no calls. I can just tell you that we had a meeting with Columbia County team, and we reviewed all the grants that we're working on, the equipment that hasn't been in, got delivered yet. We also, the 2 teams decided that on the first Sunday of each month, they're going to start drilling together. So that's a positive thing. Tier 3, Dan King and I, we had a meeting today just to remind that emergency management for elected officials will be held on April 27th, starting at 6:30, and it will probably go to about 10 o'clock, like it did last year, or a couple of years ago. April 21st, I'm going to conduct my battalion meeting. That's where I bring all the fire chiefs and line officers in. With COVID, this will be the first time we really got together in 2 years. So I'm looking forward to that. We're normally on normal battalion meeting, there are roughly about 70, 75 officers in. So we're looking forward to that. One of the things I'm very happy, I've been pushing for it, and we finally submitted last Thursday the FEMA fire prevention grant for a fire prevention trailer. I can't say enough to Fire Deputy Alberti, Rich Frasco, Louis Bircher for the assistance in this task. We received 24 out of 27 letters of support from fire companies throughout the county. And we also reached out to the elected officials down in Washington. That's our representatives, and also the state with letters of support that have been completed last week. So we'll find out probably roughly, I would say, the end of September if we get awarded. My last thing, I just want to let you know that the spring fire training has started. And I'm happy to say that with everything that's been going on over the last 2 years with COVID, we have a full class of first class is up to 24 in attendance. And the next 2 weeks, we have a couple more courses and they're half full. So things are starting to go back into normalcy and like report. So other than that, that's all I have. Any questions?
John, when does the burn ban go into effect in the springtime?
It starts, I believe it's March 15th through May, right?
May.
If I'm not mistaken.
Okay, all right.
So. Yep. Any other questions?
John, did you have a time on that April 21st meeting?
We start at 6:30.
6:30.
And Randy and I are working on the agenda right now. And then the most important is question and answers at the end. But, we usually get a good attendance, so feel free to stop in, even if it's just for half an hour.
Yeah.
And, got it? Thank you very much.
Thank you, John.
Thanks, John.
Thank you, John.
Okay, and tonight we also have Sheriff Kuzminski. Got a few things to speak to us about. Everybody should have a memo on their desk.
Good evening, everybody. I've been told to cut this down, so we're going to make it quick. As far as the numbers go, we had 155 civil attempts, 76 civil papers served, issued 83 traffic tickets, investigated 54 traffic accidents, and 19 arrests, 1 DWI arrest, handled 439 calls for service, and made 261 traffic stops. Along with that, we issued 8 Narcan rescue kits. On February 1st, the starting jail population was 40. As of February 28th, it was 36. The high for the month was 41. Corrections officers did 44 transports, traveling 2,104 miles, totaling 88 hours, moving 44 inmates. We have 1 state-ready inmate in our custody. Just as a side note, anybody in the village tomorrow is going to be a disaster. HBO is coming and blocking off 3 roads. At some point, Sean and I think Warren's involved in this, we have to do something about parking. They overflow the county parking lots and leaving nowhere else to park. So that's going to have to be addressed at some point. Tomorrow, if you plan on coming to the village, good luck. The only other thing I had tonight was I wanted to discuss the rehabbing of the old range that we'd spoken about last year. We've been forced to borrow range space from the Coxsackie Sportswood Club and from the Greene Correctional Facility. But there have been some scheduling issues with both of those options, and we drastically have to change the way we do things to get our people trained. So with that, I did bring an entourage, as I was told, with Captain Tracy Quinn, Sergeant Richards, and Sergeant Merritt. If you guys could come up, they've got some details on this. If anybody's got any questions, I'll take those before I turn it over to them. Well, you?
Hi, everybody. Thanks for allowing us to come here and speak to you tonight. Obviously, training is of the utmost importance to all of us and to the community, as well as staying with accreditation standards now that we're accredited. It's become increasingly hard with us not having a range for the past several years. Like the sheriff said, we've been using other people's ranges, the state, which obviously they need it as well, so they're trying to squeeze us in. It's also fiscally not, really the best thing when we're having to pay people to travel to Columbia County or, to other ranges or Earlton when they're available. At last minute, sometimes they'll cancel on us. So we'll have a bunch of people scheduled to go and have changed schedules around, but then, that range becomes needed by the people who it belongs to. So we're asking that you read the handout that we gave. We have a bunch of information in there that we've gathered as far as cost effectiveness and like the sheriff said, we've got Sergeant Richards and Sergeant Marriott. They're both our head firearms trainers. So they're here to answer any questions that you might have. Anybody get a chance to read it?
Yeah, I read it. So
Questions?
you think that this company will come in, abate it, get it up to snuff on environmental standards?
So NRange is based out of Miami. They specialize in doing lead abatement. So essentially what happens is lead, when it sits, becomes inert. And once you move it around, till it up, it can become airborne and it can move through water to lime, makes it inert and kind of locks it in. This company comes in with machinery. They till up the soil. They work all the way through. They remove all the lead, excuse me, if they possibly can. And they till lime in as well to lock everything in. I talked to them last June and it was right around 70 cents a pound they were getting for lead. They go and turn it in. One of the nice things about this company to help offset costs is they actually sell back a portion to us. Last June, it was around 35 cents a pound they would actually pay back. So the estimates that they gave us at that time was $200 a linear foot. So it was roughly around $40,000 to $50,000 to do the rehab. That was before whatever money we would get back for whatever lead that they collected. So that range has been in existence for as long as I know. I don't have any definitive dates and there has been no lead abatement whatsoever. So there could be quite a bit and that would come off of that number for us. At the end of the day, cost effective, personal opinion, we're better off to rehab the range. The way New York State works is if it's a range and you can do lead abatement and you can use the lime to keep it there. If you shut down a range, DC comes in and you have to turn it back to natural. So it's not lead abatement. You have to remove all lead, any traces of it. So if we were to go to a new facility, we would still have to do and bring the range back to its original form, and getting rid of all traces of lead is far more expensive than just the lead abatement.
So what do you do moving forward as far as preparing the range? So we wouldn't have to do this particular extensive rehab again. Is there something you could do to collect the lead easier, or would you set up?
You buy boxes.
You can. So cost effectiveness, when you want to look into it, you can buy different types of traps, boxes. You're getting into the hundreds of thousands to be able to set up systems to be able to collect it and to be able to clean it up. This system that they have, they recommend, EPA recommends that you do a 4 or 5 year cycle, that you go back through and do the reclamation as you go. We've done 40, 50 years, so be it. So you could stretch that out some. Cost effectiveness and money you're putting out initially, rehabbing the range right now, go through the back embankment, get all the lead out that we can, we get paid back for it, reshape the rear embankment, bring it up higher, bring it to a better angle, and that's closer to the targets. It's going to be safer for everybody at that point. And then we just get on a schedule of, even if it's 6, 7 years, that we go through and do that reclaiming. The reason for that too is just as erosion. The bank probably started straight up, but now it's at about a 60-degree angle, which is where we came into issues that we've had in the past. We need to bring it back up. And after 5, 6 years, that erosion starts to bring it away again. That's why you do the rehab, because you don't want to really mess with it, because it makes the lead airborne. Do the abatement and then bring that back up. You're still going to have to pay somebody to come in and get the lead. If we spend $200,000-$300,000 to get a bulletproof trap system, you're still going to have to pay somebody to come in to get rid of it.
Additionally, Sergeant Richards met with Scott Templeton last year when we were going to try to start this, and the county can do the majority of the burn work and rebuilding.
So you're figuring right now it's 40 or 50,000, so 6, 7 years from now, it'll even be more. So is it more cost effective to set this up now with a capturing system rather than next time you go to do it, it's 100, 150,000? I mean, is there some way you could come up with a price on how much it would cost for that? So, you know what I'm saying, to prevent, because it's not gonna get cheaper.
No, it's not. Like I said, one of the benefits too is being able to get the payback from them from what lead that they do take. I will get prices, because I also can get more definitive prices on what they charge to come in to clean out the traps as well, because that'll be a cost associated with it too.
But maybe they'll give you money on that too.
Yeah.
How high is the current berm?
It's maybe at 10 to 15 feet
So
at the peak, but it's at about 60
Yeah.
degrees right now. So it's a gradual slope.
So it's gotta go up to almost 30 feet?
I would like to get it up to that.
Build it back.
The initial thoughts that we had was there's quite a bit of fill behind that area. We wanted to push from behind up to the embankment and build it from behind, and then be able to slope the face of it.
Is there a preferred soil for recapturing lead and for, sand or something?
Sand would work just on the face. The
Yeah.
bullets tend to not penetrate more than about a foot to 1.5 feet into the sand. NRA guidelines, they just ask for no large rocks that you can have deflections.
Right.
What are you guys talking about shooting here? I mean, it's not like you're gonna be shooting 50 caliber barrels. I'm always talking about qualifying with service revolvers or pistols.
Yep, we do our service pistols and the
Rifles and shotguns.
rifles and shotguns. Anybody
Your
else?
ammunition would be all full metal jacket, wouldn't it?
When we are doing training, yes.
Okay, wouldn't the brass coating contain the lead?
Well, it's not a copper solid, it's usually a lead core of a
Yeah.
copper jacket, so.
Yeah, so wouldn't a copper jacket more or less? No.
No, it all breaks down. As soon as it hits something, it impacts, it opens up.
So if you look at the full metal jacket as well, it jackets the top and the sides. If you look at the back of a fired bullet, it's actually exposed lead on the back of it.
You shoot ball ammunition, just
That's what we're talking about.
unjacketed, you know, just regular lead? Or that wouldn't be?
That is what we're talking about, the full metal jacket. It's still not totally encapsulated, and as it goes through the rifling, it pulls off that coating.
Right.
And it exposes the lead. There is lead-free rounds that you can fire, but now we're talking about 10 to 15 times the amount of money per bullet fired. Literally, it's not even in our.
So once this whole thing's done, though, it's not like you're shooting into the fall or the winter. You gotta qualify once a year, correct? So
It's twice a year.
like once every 6 months?
Correct. This year, the training schedule is set up for twice a year. There's certain requirements for accreditation, or certain liability standards that you should follow. And it's typically a daylight shoot and a low light shoot. So we go out in the evening, low light, getting into darkness, using flashlights, that type of stuff. So it's usually twice a year, but the ammunition count is typically the same as when you do 1 day a year, or just splitting the day.
Don't you do practice range too? I mean, you would go down there and practice, right, with Zoom, right?
It's been years since we've had that option, so.
No, but I'm saying once it's over, so you would be shooting more than 1 day, people would go down practice.
Typically, yeah, right.
And when we do the night shoots, generally we don't go past 8 o'clock, and we try and do it in the fall to where it gets darker earlier, so we can get that low light that we need to be able to get the training for our guys, because we have guys that work at night only. So we try and do the best we can to keep everybody around us happy and do it when it gets darker earlier so we can get them out earlier.
Has there been any concerns from the residents of Cairo about the range going back into operation?
I haven't heard any. The only issue that I have, and I talked to the sheriff about it earlier, is if this does come back up and running, training, I would like it just for our Greene County Sheriff's Department. We've ran into problems in the past with outside agencies coming in using the range, and it was just a lot of noise every day for quite a while. So that's one thing that I would request, that you guys use it only. Don't invite outside agencies in, because that's where we run into problems. When you guys qualify twice a year, during the day, usually generally we do it in the morning. It wasn't much of an issue. But at night, there's some question. You know, people don't like to hear that at night.
If you look at that proposal.
Yep.
There's also potential to build side berms there.
Right.
to Prevent some of that.
That'd be great.
Yeah, that was one of the things that this letter, and if anybody ever has any questions, please contact me. But one of the biggest things that I want, if you know the layout, we're firing toward the firing line, and hurling is to the left.
Mhm.
I'd like to be able to put an 8 to 10 foot berm up right along the main firing line, just 25 to 30 yards back, and the shooters will be right next to that, and trees along the top of it. Simple to be able to do. That's going to keep a lot of the noise from heading out in that direction. Houses are closer there. The closest house is about 250 yards through the woods, straight shot. But once you go the other way, you have the entire town park. You have the creek. You have a lot of space before you get to the next house. So blocking that side is going to really help out to keep the echoing from going that way.
Yep. And I don't know for sure, but I believe this range has been in operation since the late 80s. And my memory serves me right. So it's been a long, long time that you've been using it. And I think it's been, hasn't been used since, what, 4 years, Sean, last we used it?
Gotta be.
Somewhere when the construction of the solar farm up there, that's when it stopped. So,
Yeah, that's sort of Marion said earlier. We typically do our low light shoots later in the year, October to November. So it's not too cold that it's unbearable to be out there, and we still have a good training environment and keep their attention. And that way it's not so late in the evening that we have to worry about upsetting the neighbors. Yes, of course it's gonna happen, but we're not talking about 10 o'clock at night. We're typically done shooting by 8 o'clock at the latest.
So how many deputies do we have right now on the force?
35.
35.
So,
So-
but we have all the correction staff as well.
So how many altogether?
So altogether, we have.
Sheriff, we have-
I believe.
How many?
Everybody that qualified.
Say 70, say
I was
75.
gonna say something.
75,
So
somewhere.
75 law enforcement individuals twice a year. That's not that bad.
Oh, honestly, you're talking for qualifying, you're probably talking about aggregate combined 4 to 5 weeks. You know, but it's a 2-week
Right.
block here, it's a 2-week block there, because we have limits to how many students we can have shooting per instructor.
Mhm.
So we generally don't have lines of 15, 20 people. We try and keep the groups a little bit smaller to get a better training environment and more time to work with each student. So we'll generally have maybe 5 to 7, somewhere in that range that we try and fit them in.
Yeah, I think it's important, again, to go back what I said, just use it for the Greene County Sheriff's Department, no outside agencies. Because that's where we run into problems.
It's not in Sean,
It's always,
it's not 4 to 5 weeks every day.
I know,
Yeah.
We're talking 12 to
Right.
14 days.
For
within a
us.
4 to 5 week period.
for us, right,
When we do the training.
right.
But
But
it's
if,
usually 12 or 14 days when we're actually using it during that period.
Yeah, I'm not saying it's 2 weeks straight every day.
no, I
It might
understand,
be 2 to 3 days. So
understood. But when you start inviting outside agencies in, it just, it's forever.
You know,
And that's where we have issues.
Wouldn't be bad if they coordinated almost to occur in the same timeframe. If you're, willing, to have us, your local police
I was
departments,
gonna say your village.
right, your village and your town police at the same time that you guys are doing your training, so like Harry says, then you don't have it, all these different times.
Yeah, I don't see it happening anymore because there were a couple local agencies that used our range when it was open. But since then, because of it not being used, they've found other locations where they go.
Yeah.
Some of the departments have teamed up with another department, they use a range someplace else. So we haven't had a range to even have that discussion.
So I know years ago, not to interrupt you, but I know years ago firsthand, an outside agency came in and it was for like about a week period. It was not our people. And if my memory serves me right, and it was very, very noisy, loud, continuous. That was a problem. That's what we don't want.
And ours are gonna be, they've broken their trainings down into like 4-hour blocks. Instead of doing like a whole day of shooting, it will be a 4-hour.
Mhm.
So it shouldn't be too bad.
But we got to get there first, right? We got a lot of work to do here. You got to do your berm, you got to do your abatement. There's a lot before you even get there. So.
Anybody else? Thank you.
Thank you.
Sean, are we gonna then bring this up at the next month's calendar for
Well,
type of resolution, or is it already in the sheriff's budget?
No, I would need to allocate, I would like us to evaluate the boxes.
Yeah.
Discard it if it's just too expensive. Okay, we talked about that 2 or 3 years ago, of trying to put in the boxes, and it's more, I think DEC would like it better, certainly, because you're capturing that lead, not having to worry about it. And you can leaching out at any time to your next cleanup period, so. But if boxes are hundreds of thousands, then the budget may not just allow us to. Do
Okay.
And then if there's gonna be in-kind services through highway, then I'm gonna have to program that into the highway schedule as well.
Gotcha. All right.
Okay, into the proposed action item, it's, items. First one is authorizing the application to New York State Division of Criminal Justice Services for alternatives to incarceration funding.
Martinez, Bloomer.
Martinez, Boomer, all in favor?
Aye.
Opposed? So carried. Number 2, amending resolution number 71-22, appointing members to Greene County Fire Advisory Board 2022.
Lennon.
Lennon, I'll second it. All in favor?
Aye.
Opposed? So carried. Number 3, appointing members, Greene County Traffic Safety Board.
Handle.
Handle, Hobart. All in favor?
Aye.
Opposed? So carried. Number 4, budget amendment, Greene County District Attorney Discovery Reform Funding Plan.
Martinez.
Martinez, Bloomer. All in favor?
Aye.
Opposed? So carried. Number 5, budget amendment, Greene County Sheriff's ORCCA.
Davis.
Davis and Handel. All in favor?
Aye.
Opposed? So carried. Anything else to come before Public Safety Committee?
Motion to adjourn.
A motion and a second. We are adjourned.